Here's her command. You want to take that one? She can sit. Yeah. Whatever it's easiest. Okay.
We want to welcome everyone this morning to this event. My name is Scotty Day. I'm Associate Chief Medical Officer for Kentucky Children's Hospital and UK Healthcare. Today is a historic day for UK Healthcare, and it is a real privilege to have this family here with us who have given their time. And for those who can't see, the star is right here. So say hello. Please don't get me, just get the baby. So we want to have a chance to really welcome you all here. We're going to start out with introducing Bo Cofield. Bo is the Chief Clinical Operations Officer for UK Healthcare. We're glad to have him here, and we'll let him share a little bit.
Well, thank you very much, Scotty, and thank you all for joining us here today, and a particular thanks to the Wilsons for being willing to share their story, because it's an important day here at University of Kentucky and UK Healthcare to acknowledge that we've resumed our pediatric congenital heart program. And this has been a labor of love for a lot of people in this room, but more importantly, a lot of people who are providing care right now in the Kentucky Children's Hospital and Cincinnati Children's Hospital Medical Center in Cincinnati. We've partnered with Cincinnati through an agreement that was finalized in January of 2016, and a lot of hard work since then in order to resume caring for these patients surgically. While we've got a fantastic pediatric cardiology program, we paused our surgical program a couple of years ago because it wasn't what we wanted it to be, a world-class program, and we really believe that we've got that now through this partnership. And the joint team has really made this goal a reality. We want to thank Dr. Reddington and everyone at Cincinnati Children's Hospital whose commitment to this partnership has made it a success. We also want to introduce you today to Dr. James Quinisenza, and recruiting Dr. Quinisenza was one of the most important steps and components of this program, because he is a world-class pediatric cardiothoracic surgeon that now works alongside our world-class pediatric cardiologists here at the Kentucky Children's Hospital. Dr. Quinisenza, would you like to make a few remarks?
Sure. Well, thank you. Nice to meet you all. We're very excited and happy about what's happening here at our Lexington campus as part of our joint program. And it was a great opportunity for me. I'd been doing congenital heart surgery for a long time in the South, and there was an opportunity to come in here, I think, do something really significant in trying to continue the efforts of what Cincinnati Children's has been doing in terms of pediatric heart care in Kentucky and throughout the Commonwealth. And it has been a lot of work that predated my arrival. It continues to be a lot of work, but I think we have the opportunity to do really provide excellent care for the patients of the Commonwealth and maybe even beyond. And we're off to a great start, and we're happy to be here.
Thank you, Dr. Wilson. So I would like to introduce to you to the far right Dr. Reddington. He is the Executive Co-Director for the Heart Institute at Cincinnati Children's Hospital. He has been there for
2.5 years.
2.5 years, and his leadership is world-renowned. We're very lucky to have him as a partner, and I'd like for him to say a few words.
Well, thanks, Scotty. It's a real pleasure to represent Cincinnati Children's as part of this partnership. Although I've been in Cincinnati for 2.5 years, my first contact with our now colleagues in UK was between being appointed and starting the job, and I think it's almost 3 years to the day that we came down to discuss the possibility of forming this one program, two sites model to deliver care. Something that I'd actually had some experience of and know can be successful when I was working in Ontario, when I was in Toronto, Sick Kids Children's. So it was an easy fit for us. About 700 people get up every morning to look after children with heart disease in Cincinnati Children's. And what we want to do is provide the best level of care for as many children as possible, as close to home as possible. And for patients and children that travel maybe 100 or 200 or 300 miles to get to Cincinnati, that's a burden, and we recognize that. And so the ability now to provide the same level of care as we provide in Cincinnati, but at the UK campus, is a tremendous relief for parents and patients. It relieves an enormous burden. They're able to stay, and I suspect we'll hear about that in a little while, closer to their families. Maybe they're losing less time from work. And at the same time, we are participating in a group now that makes Cincinnati Children's better, because we can do the surgery that we are best providing, that high level of surgery that perhaps UK doesn't do, but at the same time participate in a truly seamless program. Every single patient within the program is discussed in exactly the same way, is treated in the same way, and ultimately will get the same results. So it truly is a partnership. I think it's the right thing for Cincinnati Children's, and it's the right thing for the patients in Kentucky. It has been a 3-year journey. So 3 years of preparation, training, communication. I think 100 or so people from Kentucky have come up to Cincinnati. We've been down here to align our protocols and our management system so that when we started the program a few weeks ago, we knew it would be successful. We'll probably hear a little bit about the numbers, but everything has gone extremely well so far, and we anticipate that continuing. And it's no small measure due to the fact that we've appointed one of the best surgeons on the planet. And I have to say, he's surrounded, and this is just as important, by a team of committed and dedicated individuals, the like of which I have never worked with before. And this is not BS, I can tell you, this is real. The amount of attention to detail and the commitment that the folks down here have shown has been amazing, and it's been a pleasure to work with them.
Thank you, Dr. Reddington. So as you can hear, Magdalene's really anxious to get to the mic. So she said a few words. I don't know if you guys caught them, but we can have her speak a little later. But really, this is about the family. You know, we talk about being the University for Kentucky, being the Children's Hospital for Kentucky. This family is what this is all about. And so I'm going to open it up for them to say a few words.
Well, I think really we'd just like to say thank you to everybody on this panel and for all the staff. I see some familiar faces in the room, and everyone who really provided excellent care during Magdalene's stay. You've really, I think, displayed a single program in 2 locations with all of the Cincinnati staff that we witnessed here the day of her surgery and throughout the critical periods of her care. And you guys have done a great job, I think, especially this ma'am, to set her up for a good future.
So can you walk us a little bit through kind of when you guys were kind of making that decision, how you came to that?
Sure. We had been working with midwives initially through our pregnancy here in Lexington, and when she was diagnosed at about 30 weeks with some heart issues, we were referred to Louisville, where we spent a lot of time bi-weekly making visits. By the time we would travel from Nicholasville from home, it was a couple hours each way, plus the office visits, 3 or 4 hours. So I was taking full days off of work and spending a lot of vacation time, and it was more of a struggle on the family, I think, to recruit childcare for our 3 other children as well. And so when we, I think by the grace of God, were able to come to the UK ER, not that we wanted to be there, but through that process, we're really introduced to the University of Kentucky and the program here, and I think our general experience with the cardiology team and Dr. Day and all the doctors that were involved in her care initially, we just really came to appreciate this place and appreciate the plans that they had for her and the approach that they were taking.
And can you comment a little bit about the care as you've been following up and how that's worked, or any comments around that after you were discharged?
Yeah, post-discharge, we've made, I think, one visit to the pediatrician for a basic weight check and to make sure things were still on pace. And we've been back to the cardiology office here once for an echo and EKG and basic consult, and things at that point were progressing well. I think within 2 short weeks of being discharged, she was completely feeding on her own, taking full bottles. We were able to remove her feeding tube and knock off a couple of her medicines as well. So she's recovered really, really well.
Very good. And I want to mention Dr. McCool, who's the cardiologist, was out of town and unable to be with us today, but he was the cardiologist. So at this time, we're going to open it up for a few questions, if there are any questions. Okay. Well, I want to say the team, when they mention the team, and not just these people, it is a team of probably 250 or 300 people from both campuses. It is truly a one program, 2 sites model. It is from nursing. We've had extraordinary nursing leadership both here. It's just really a joint program. So it looks the same no matter where you're at. From the intensivists, from a very strong cardiology group led by Dr. Snyder, from a strong nursing group, and I won't say a lot of names, but a strong program group. It has been such a privilege to even be a part of the team, and a privilege to stand at this podium today. I think this exemplifies what the mission of the University of Kentucky. It exemplifies the mission of Kentucky Children's Hospital. And as a parent, as a doctor, a family of 6 as you, it is really such a great honor to be here. So I want to thank everyone for attending, thank our colleagues in Cincinnati for coming down, and have a wonderful day.
Do you all have any individual questions?
Very good.